Have you ever wondered how we know if a newborn calf got the right start to life? When calves are born, their immune systems are completely naive. Unlike humans, calves don't get any antibodies from the moms through the placenta. So when they hit the ground, they're starting from scratch, and colostrum is their first line of defense. Colostrum is the first milk a cow produces after giving birth. It's packed with antibodies, and it is absolutely critical that the calf gets it quickly, in enough quantity, high quality, and clean. These 4 things make or break the start of a calf's immune system. One way we check if a calf got the colostrum it needed appropriately is by testing for serum total protein. It's a quick, low-stress blood test we usually do a few days after birth. Here, I'm going to take a blood sample from a calf while it's taking a nap. This is totally normal and not painful. I approach the calf gently and I take the blood sample from the jugular vein. This is done with a vacutainer tube, meaning the needle goes in and then the tube goes in and it will draw the blood out immediately and then I can remove it. You can see the calf barely reacts. As a veterinarian, this is a big part of my job, assessing the protocols that are performed on farm to make sure the calves are getting the proper start to life. Sometimes this process is easier to do when the calf is standing. I'll gently help the calf to its feet. See how I just stroke its back? That encourages them to stand. Then I back them into a corner, turn the head slightly, and feel for the jugular vein. Once I see that vein fill, I use a vacutainer to draw just a few milliliters of blood. I am usually doing this by myself, but I also have trained animal health technicians on farms that can perform this procedure on their own. Once we get the blood sample, then we spin the sample down and test the serum for proteins. A good serum total protein level tells us that the calf received appropriate passive transfer of immunity. If the calf didn't get enough colostrum, or if it was poor quality, given too late, or contaminated, that's called failure of passive transfer, or FPT. And unfortunately, that calf starts life at a disadvantage. After 24 hours, their gut closes and they can't absorb those life-saving antibodies anymore. Sometimes the calves need a little help standing, and that's a really important part of working with calves, making sure that we are always handling them gently and with care. Calves are just newborn babies, and they don't always do what we expect them to do. So it's important to treat them with kindness and respect. In addition to a good colostrum program, we also look for good housing and good care for the calves. Proper colostrum care is a huge part of raising healthy calves, and it's something I check for regularly as a veterinarian. Thanks for watching. If you have any questions about colostrum or calf care or anything on the dairy farm, drop it in the comments. I'm going to do a Q&A later this week where I answer the top 3 questions on my video. Hit that subscribe button if you want to learn more about how we care for calves on dairy farms. And I hope you can follow me and learn more as I go along. Thanks!